Hi madam. So here are the typical steps for applying rigid tape. As we know, rigid taping technique is used in sports medicine and physical therapy to provide support, stability and reduce the risk of injury. Do this technique, first of all we have to make sure the skin of the person should be clean. So the next one is position the body. The position of the body should be neutral position, or we can change according to desired position to support and depending on the injury. So first of all we have to take the rigid tape and then we have to overlapping slightly with each layer. These layers should be progressively provide more support, and then we have to make sure to be careful while handling this kind of technique. We should bear in mind that be careful not to apply the tape too tightly, as this can restrict the circulation of the blood. So apart from that, we have to be make sure to tape correctly. So I'm following the method that I learned during the we went to the center and I learned from that. So after the taping is complete, ensure the athlete can move the joint slightly and that tape is not too tight, which can impede the blood flow. So apart from that, we have to make sure that while handling the taping method, once the taping is complete, we have to cover up the tape with the rigid tape to secure the tape. So once the tape is complete, the individual tests the movement to ensure they feel supported and stable. So here this patient is completely comfortable with this taping.
I'm Durgalaksmi. Today I would like to explain about general kinesiology taping in this video. This is kinesiology tape, which is help with pain and also swelling. As a first step, we need to cut the kinesiology tape based on the affected area, such as knee. Then we need to cut the sharp edge of the tape to apply it on the affected area. Moreover, after cutting the sharp edge of the tape, we need to cut the tape into two parts to apply it on two sides of the knee. Here I have cut the tape into two parts to apply it on two sides of the knee. After that, we need to take out the stick paper from the tape to apply it on the knee. And now the tape is ready to be applied on the knee. And then we need to apply the kinesiology tape from upper to lower around the knee. end of the taping, the tape should give a cross look on the lower of the knee. As the last step, we need to measure the size of the knee to cut the kinesiology tape. We need to apply the kinesiology tape on the lower part of the knee to give a support to the knee. And also, same method applied to this taping, which is we need to cut the edge of the tape. And then the tape is ready to be applied on the lower part of the knee. We need to stretch the tape when we apply it on the lower part of the knee because it gives the strength and also supports the knee. Finally, this is the final look of the knee after the taping.
Good day, madam. I am Joanne here. So I have participated in the edema kinesiology taping technique activity. Firstly, we have to know the length of the ankle and we have to cut 2 stripes. So from there, after that, we have to make sure the length is okay and we have to cut the edges into a circular motion. The edges are cutted in circle types so that it won't come out easily and it will give a better elasticity as well to the skin. After that, we have to cut the stripes into 4 stripes. For the edema taping technique, we can use 4 to 6 stripes for the patient or the injured person. So for my activity, I just did 4 stripes as how the professionalist has taught us. So now I'm cutting it into 4 stripes. First I divided into 2 and both of that I cut it into half as well. Cutting the kinesiology tape also needs a perfect amount of focus because if we cut it unevenly, we might have an uneven adhesive tape. So we need to give a good focus so that we could cut it evenly and give the good effect after applying the tape. While applying this edema tape, we need to have a good focus so that when we apply, we will apply it in the right direction and we have to give a good focus while applying this tape so that it could be attached to the skin properly. In this part, I'm attaching the tape to the right side of the ankle of the injured person and then I would also be applying the tape to the left side of the ankle. So this tape is something where we can tell as we are trying to do anyayan, which we call it in Malay, where we use it to do for the the bamboo shoots. Later on, after that, we will be taking the stripes from the right bottom to the left and then we will continue doing it to the left as well. This is how the tape looks before the application and after it is applied, it looks like spider hands. So that's why we call it as spider technique. Thank you so much for this opportunity, madam.